now for the first time in 1.5 months, COVID cases in India have dipped below the 8 lakh mark. 62,212 cases with 837 deaths have been reported in the last 24 hours, with 70,816 recoveries in the past 24 hours as well. 5 states which reported the highest number of cases and deaths in the last 24 hours include Maharashtra at 11,447, Karnataka at 7,542, followed by Kerala at 7,283 cases. And then we have Tamil Nadu, where 4,389 cases were reported. But in Andhra Pradesh, just a little under 4,000 cases have been reported in a matter of 24 hours. When we take into account the kind of deaths that have been reported in Maharashtra, 306 lives have been lost to COVID-19. In Karnataka, 73 lives have been lost, while in West Bengal, 61 people died of COVID-19, and in Tamil Nadu, 57 people lost their lives, while in Uttar Pradesh, the death toll is now coming in at 46 as far as the last 24 hours are concerned. And now the centre has deployed teams to Kerala, Karnataka, Rajasthan, Chhattisgarh as well as West Bengal, the states that have been reporting a surge in new cases in recent days. Now we have Sukirti joining us as well. She is going to in fact give us a more recent update as to what the situation is like on the ground, as well as what are the kind of instructions that these teams have been given. Sukirti?
Well, yes. The points, major points to note at this point of time, that this is for the first time, if we look at the All India picture, that our active cases are below the 8 lakh mark, and this has happened after a span of about 1.5 months. The last time our active cases were this low were on September 1, and after that, this is the first time that the active cases have gone below 8 lakh. Otherwise, they have revolved around the 9 to 10 lakh figure. So controlling active cases is one mission that governments are constantly on, because you always want to have lesser number of patients that are being treated within hospitals. So that's one positive sign. However, the worrying figures seem to be coming from states like Kerala, Karnataka, Rajasthan, Chhattisgarh and West Bengal. And West Bengal, a bigger worry, because not only for the 5 days it has been recording its highest daily cases consecutively for the last 5 days, and the Durga Puja is just around the corner, and big crowds would be rushing in pandals and other places in markets. There would be crowds, so the situation could become a bigger worry. So central teams have been sent. These central teams comprise of a joint secretary level official, then there are clinical experts that have been a part of these teams, and they have been asked to help and guide in the containment and surveillance measures, whether testing is happening in the right manner or not, optimum number of RT-PCR tests are being conducted or not. Those are some of the key guidelines that they have to follow, and of course the hospital management. So those are some of the things that these central teams will be looking at.